Okay, hey everyone, what's up? Welcome back to the Nurse Talk podcast. We have Chester Apostol. Um, uh, to those who are watching, siya yung episode 1 natin. No? Siya yung nag-umpisa nitong lahat.
Yeah.
Yeah. And we are back kasi we're going to talk about case management. Kasi this is a good alternative to those who want work outside bedside nursing. So, welcome to the podcast again,
Thank you. Thank you.
Chester.
And thank you for having me again. And para sa mga bagong nanonood, I was the first, interview dito sa series na Nurse Talk ni Kuya Dean. And it's such an honor not to see his channel grow. So guys, please continue to support him. Napaka-informative. Kita nyo naman, he takes so much effort dun sa mga videos that he records. Lahat para sa inyo. And if you don't know, he's still waiting for his petition date to be current na rin. So he's one of those aspiring Filipinos. So just seeing the channel grow, guys, para sa inyo to lahat. So continue to support his channel. And last episode, I was actually still med surge. I was a med surge nurse. So ngayon, you can see the growth then. Ngayon RN case manager na ako. So thank you again, Kuya Din, for having me. I'm very excited to provide information and tumulong na rin sa mga kapwa Pilipino and other nurses na nag-aspire din.
Jad, thank you sa introduction.
Hindi namin pinag-usapan yun, guys. I'm just
Okay.
very, very honored to be here again.
Okay, chat. So, kumusta? Anong bago since nung last episode natin?
A lot actually. So, nung first episode natin, I was still a med surg nurse, and I was coming from working as a pediatric nurse sa Philippines. And so, yung transition from the Philippines to the US, it was a bit, culture shocking siya. Kasi iba sila gumalaw dito, iba yung resources mo. Pero, nursing is nursing, principles wise, it doesn't change. Mabibigay at mabibigay mo pa rin yung gamot, just those things. You know, it's ever changing talaga ang nursing. It's very, very interesting.
Mhm. Ano nga ba yung hospital mo dito sa Philippines before? Bago ka
I
mag-migrate?
used to work sa Fedel Mundo. So shout out sa
Mhm.
Fedel Mundo.
Yeah. Okay, so from bedside nursing to case manager, saan mo nakita yung idea na to na may ganun pala? And
So,
bakit ka naging interesado dun?
yeah. So yung friend ko actually, hindi niya talaga hilig ang bedside nursing. Tapos ako at that time, parang medyo napapagod na rin ako. Sabi ko, parang, ba't ganun? Ang dami kong ginagawa, pero I don't feel fulfilled. Normal daw yung pre-shift anxiety, ganyan.
Mm.
Kaso parang medyo napagod na ako. Sabi ko, ano pa ba ang pwedeng venues ko na hindi na ako kailangan directly sa pasyente nagmamanage? So sabi niya, try mo case management, pre. So ano ba yung case management? So nung tiningnan ko na kung ano yung case management, sabi ko, ano bang kailangan dito? And usually, ang experience na hinahanap nila is at least 2 years.
2 years bedside, no?
Mm. Yeah.
Mhm. I see. And then, so was it the same hospital or lumipat ka rin?
So lumipat din ako. Lumipat ako. It's a smaller community hospital. Um, and very thankful ako actually kasi in a way they took a risk on me kasi usually ang mga hospitals gusto nila talagang aside from bedside experience, gusto din nila ng merong case management experience. And it's very challenging din kasi your usual requirements nila would be around 2 to 3 years at a minimum na case
Mm.
management experience up to five.
Uh,
So in a way, yung current hospital ko ngayon, they took a risk on me. Pero during the interview, I was very proud to say na sabi ko, I work with, other case managers dun sa previous hospitals ko. And I asked them what it's all about. So in a way, I did my research ng sarili kong diskarte. And I just told them, if you take a chance on me, it's just all a matter of ako trying to prove myself to you na, I can be an effective case manager.
ang ganda naman na sinabi mo yan. Yeah, that's good, ah. So, paano mo siya, can you describe us ano yung mainly na ginagawa mo as a case manager?
That's a very great question, and actually, case management in general is very broad, I would say. Kasi hindi lang siya yung sa ospital. You also have case managers na nasa insurance. You also have case managers na nasa skilled nursing facilities. Ganyan. So it's very broad. Pero ang gusto kong i-discuss would be kung ano yung na-experience ko, which is hospital case management so far. And so, ang gusto kong i-describe yung case manager would be like a tour guide sa hospital. And the reason why I say that, kasi case management starts from the admission ng pasyente. You're already looking at yung course of treatment niya, and that is why kailangan mo ng at least 2 years experience kasi you need to kind of understand kung paano magfo-flow yung care sa hospital. It's also part of it na parang yung business side na ng nursing. What can we do for the patient that is cost effective for them, at the same time hindi wasteful sa resources ng hospital? So you kind of guide them step by step from admission. Kausapin mo na kaagad yung pasyente. Ano yung discharge plan nyo? Uuwi ka ba? Open ka ba sa skilled nursing facility? Okay ka ba sa home health? Things like that. Meron bang mag-aalaga sa'yo sa bahay? And then at the same time, habang nangyayari yun, you're also talking to the doctors. Hi doc, kita ko dito mukhang merong psychiatric condition yung patient. Pwede ba tayong maglagay ng psychiatric consult kung hindi pa nila ilalagay? Ganon. At the same time, present din natin kasi sa amin, every day we have meetings where we discuss each patient kung ano pa yung kailangan gawin sa kanila. And if you feel na in the next day or two wala nang gagawin, we have to make sure na nakaset up nila na sila for discharge, kung kailangan ba ng home health and things like that. Para at least after the discharge from the hospital, we have already set them up for success in recovery sa bahay para ma-prevent natin silang ma-readmit sa hospital. So case management, very broad, pero as I would put it in a nutshell, para ang tour guide ng hospital.
Mm-hmm. And this is office hours 8 to 5, 5 days a week.
Yeah. So karamihan ng case management positions do offer 8 a.m. to 4:30 p.m. na time slots, pero depending on where you are, yung friend ko and yung previous hospital ko before is actually 12-hour shifts. So 3 times a week lang din sila. Pero that's very rare. That's the only hospital na alam ko na ganun ang scheduling nila. Pero there are also some, like let's say, emergency room. I know for a fact, nagta 12 hours din sila. Both day shift and night shift lang.
Wait, so you're saying na sa emergency... Wait, may case management din sa ganong area? Tama ba?
Yeah, actually meron. Depending on the size of the hospital, kung necessary ba siya. Kasi if we delve into more, kaya nga, I'm very excited to share this about case management din kasi you're working with insurance din eh. And there's another case manager dun sa insurance. So it's like a two-way street. Nasa hospital yung pasyente and you want to admit the patient. Ngayon, yung insurance sasabihin, bakit mo siya kailangan i-admit? Bigyan mo ako ng reasons kung bakit namin i-authorize yung stay niya sa hospital. Can this be something na kailangan na pwedeng gawin sa outpatient setting or kailangan talagang i-admit? Sabihin ng RN case manager, well, meron siyang sepsis, kailangan niya ng IV antibiotics, nilalagnat, kailangan ng monitoring, meron siyang medyo tachycardic siya, we need to monitor further. So sasabihin ng insurance case manager, okay, sige, we'll give you permission to admit and then we'll cover his stay na kung ano man yung sa provided ng insurance niya. So those kinds of things.
So very important din na marunong ka makipag-usap din talaga, no?
Yeah. Pero, it's not, hindi ka naman yung parang hahaka-haka lang. You're gonna be using your clinical judgment, Tapos hindi ka naman yung parang nakikipag-negotiate. No? Parang medyo, mahirap ma-explain pero always well within reason naman, tsaka based on your clinical judgments yung mga sasabihin mo sa insurance case manager. Ganon.
Okay, okay. So, can you give us an idea lang yung typical day mo at work? From
Okay,
start of your
so
shift, tapos mag-meeting kayo, sinasabi mo,
yeah,
aha.
yeah.
Ah, yeah,
Hold
go
for
lang, babalik
yeah,
ako.
sige lang.
Okay, yan.
Yeah, okay, sige. Okay, so ang typical day ko would constitute me coming into work early. Usually nandun na ako ng 7:30, ganyan, and then I start working, 8 o'clock, ganyan. I print out my sheets. Doon nakalagay lahat ng patients ko. I handle medical, surgical floor, telemetry, and ICU. It sounds like a lot, pero actually, ang parang maximum ng hospital ko is around 40, which is malaki siya for one RN case manager, and I'm the only RN case manager sa hospital namin. Pero so far, hindi naman kami nakakap. So, pretty manageable ang workload ko. So after I get those sheets, I go into each patient's chart. Nire-review ko sila lahat, yung mga past na patients na, yung mga bagong admit, bakit na admit, and then yung sa mga old na patients, bakit nandito pa rin sila, ano pa ba yung kulang, ganon. Just so I get an idea kung ano pa yung each needs ng patient. Kasi everything is case to case, di ba? That's why case manager.
Mhm,
And
mhm.
then after that, around 10:30 ng umaga, until 11:30 we go down sa conference room namin, and then we have a big case management meeting, and ang mga involved doon is the chief nursing officer, the CNO, nandun din yung CEO, andun din yung director of case management, wound care nurse, house supervisor, andyan din yung director of telemetry, andyan din yung director of ICU, so talagang fully packed siya. And ang ginagawa namin dun sa meeting na yun is we're just solely discussing bakit pa nandito yung pasyente, ano pa ba yung treatment niya, what's holding up the discharge. Ganon. In a way, it's
Mm.
kind of like a business meeting, ganon, pero there are some human factors into it. Like let's say, um, something not medically related could be totally actually social. Like kasi walang magbabantay sa bahay, we need to send this
Mm.
patient out sa skilled nursing facility. Kaso at the same time naman, di ba, there's other factors na hindi agree yung family, ganyan-ganyan. So, there's a whole lot of discussions na nangyayari doon. It's very, very interesting kasi it's all different for each case. And then after nyan, I come back, I have my lunch, and then I actually only start really starting to see patients ng mga around 12:30 p.m. And
Mm.
once I actually do go and see patients, usually tinatanong ka sa kanila, saan ka nakatira, sinong kasama mo sa bahay, meron ka bang primary care physician, ganyan, meron ka bang ginagamit na assistive devices like a cane, walker, wheelchair, things like that. Meron ka bang mga gamit sa bahay na, like a shower chair or bedside commode, meron ka bang home oxygen. It sounds like a lot, pero syempre, you have to look at the diagnosis din ng patient. Tsaka, i-correlate mo kung related ba yung tinatanong mo dun sa pasyente, di ba? I actually created my own cheat sheet for it para lang mag-guide ako on my day-to-day. And then yung pag-verify ng address and bahay, in a way kasi you're also assessing yung patient, alert ka ba to be able to answer my questions? Di ba? Yung mga ganon. Kasi minsan, nakita mo medyo questionable yung sinasabi niya. So, yung ganon, kapag na-verify address, yung sinabi ko, it looks like ang sinasabi ng doktor, you're healthy enough to go home under home health. So ngayon, na-verify ko yung address na it is actually this address. So pagka nag-send na ako ng referrals dun sa mga home health agencies, I am sure na verify ko yung address, they will meet that patient doon sa address na yun. Things like that.
Okay.
Yeah, and then that's basically all I'm doing ng 12 o'clock hanggang 4:30 before I go home. Tapos pagbalik ko sa office after my assessments dun sa mga newly admitted na patients, I document everything. Tapos I also work with a discharge planner. Tapos siya yung kumbaga parang, hey, meron akong order ng skilled nursing facility, pwede ko na bang i-send out? And usually, we work well together. Yes, you can send it out. Okay, this one has home health. Let's go ahead and give it to home health. Ganyan, let's coordinate with insurance. Let's see kung ano yung contracted nila. Ganon. So case management talaga, it's very broad and very interesting talaga. And it's still nursing. Yun ang kinaganda doon. It's still
Mhm. Mhm. Yeah, oh my gosh, parang there's so much info na sinabi mo sa amin, 'no? Teka, I have a few questions.
Mhm.
Ano yung mga usual challenges mo 'pag nag-me-meeting ka with the CNO, CEO, and other, staff?
Yung ganong meeting namin, there's actually it's a matter of teamwork. You know,
Hmm.
we pull together and see what we can do for this patient and how we can also prevent further costs for the hospital kung unnecessary na yung stay nila. I have an example here where we had a patient. Usually kasi pagka-surgery, pagka nanggaling sa isang ospital, sa isang doktor, usually yung ibang tao, ayaw na nilang i-handle yon. So kung nagkaroon ng
Ah,
complications, kumbaga ang nangyayari sa mga between the doctors, teka lang, hindi ako, ayokong medyo alangan akong i-handle yan kasi complication na to eh. Ano? So, i-send back natin yung pasyente dun sa kung sino yung gumawa niyan para siya yung makapag-ayos din. So there was a point in time na I had a patient, nagkakaroon siya ng complications sa surgery, and I was trying to coordinate with the surgeon dun na gumawa ng surgery na yon, if I can send that patient back to him. So ngayon, sabi ng doktor, nag-doctor to doctor report siya with yung other surgeon namin, and kinausap ng surgeon na gumawa, sabi niya, hindi, it's okay, pwede niya kaming makita outpatient, I'll just see her at outpatient, as outpatient. Ngayon, tinake naman ng advice ng doctor namin. So sabi ng ganun, stabilize lang natin dito, and then we'll see he will see the patient as an outpatient. Kaso, during the weekend, medyo mas nag-tank yung patient to the point na kinailangan siyang mag-ICU. And then at that point, come Monday, pagbalik namin, during that meeting, sabi ng CEO sa akin, anong kailangan natin gawin para mabigyan natin ng care yung pasyente kasi wala na tayong nagagawa para sa pasyente at this point here. Kailangan ko bang gumawa ng tawag? Sabi ko, I think so. So ang ginawa niya was tinawagan niya directly yung CEO nung other hospital para matulungan yung pasyente. So that's how we did it. And it's a very proud moment
hmm.
kasi in a way, not only was I just doing case management, but we were also advocating for the patient na, hey, wala kaming pwede magawa dito. You have to take this patient back. Ganon. So it's all teamwork then. So there's really no challenges. It's just figuring out and problem solving.
I see. Okay din yun, ang galing, ah. Okay, so how do you choose ba na kung saan sila isa-send out? Kung sabihin natin madami kang selection, para meron ka bang mga go-to na mga facilities or skilled nursing facilities na nire-refer sa kanila, ganyan?
Yeah. So it's very it's a long explanation, but I'll really try to cut it short. Pero usually, kasi meron tayong mga insurances, di ba, na it's either sasabihin is HMO, which is managed siya, and then meron din yung PPO, which is, kumbaga, parang you can freely choose what you want at a higher cost. Ngayon, yung sa HMO side, pagka sinabing managed, di ba, healthcare managed na insurance, meron silang mga contracted na mga skilled nursing facilities. So let's say, from A to Z, kung PPO ka, you can pretty much go A to Z. Kaso lang iba lang yung cost. Meron ka mas higher cost. Pagka HMO naman, ang sasabihin nila, oh, contracted kami sa skilled nursing facilities A through F only. So, pagka magsasend ka ng referral, sa A to F lang ako pwede. Ganon.
Okay, okay.
Tapos, Medicare naman, that's very different din. It depends kung meron pa nga Medicare Part A, Part B, ganyan, inpatient, outpatient. So yun naman, mas may freedom din sila, and actually maraming mga skilled nursing facilities ang gusto ang Medicare because they are, maganda silang mag-compensate na
Oo,
skilled
oo,
nursing
no?
facilities. Pero there are still some caveats to it, pero that's for another conversation.
Do you have what are the usual challenges mo sa pag-handle ng mga patients? Meron bang parang magre-refer ka sa ganitong lugar or sa ganitong facility, ayaw nila, gusto nila sa iba?
Yeah, definitely. So, medyo malungkot lang din in a way dito sa case management is ako always lagi kong kinikita yung pasyente as human, di ba? Another kapwa human being.
Mhm.
Pero kasi
Mhm.
minsan, for other people, pagka nandun na sila sa case management or yung in that business, the healthcare business in general, minsan they forget na tao pa rin tong pinag-uusapan nila. And the reason why is nakikita lang nila itong tao na to through the papers we send them, clinical documentations wise. So, makikita nila na let's say itong araw na to, this patient was confused, naka-restraints, ganyan-ganyan. Tapos sinend out namin yung referral, nakita nila yon. Sabi, hindi namin pwedeng tanggapin tong pasyente na to kasi naka-restraint siya, mukhang may behaviors, ganyan-ganyan. Pero the next couple of days, syempre, makita mo slowly, nag-improve yung patient. Yung pala, magiging confused siya dahil meron siyang infection. Kaso ngayon, natitreat na siya, nagiging back to baseline, nagiging normal na. We resend yung mga, we resend yung referral, nakikita na dun sa documentation, patient is now cooperative, ganyan-ganyan. Minsan, yung previous na skilled nursing facility na sinendoutan namin ng ganon, hesitant na sila. So in a way, parang kailangan ko mag-intervene na, hey, actually, yung pasyente okay na siya, ganyan-ganyan. Can you reconsider? So ganun yung
Mhm.
mga barriers, mga challenges. Sometimes even yung mga families, ganon, let's say, ang doktor, sinasabi niya, pag pinauwi namin tong pasyenteng to, even conversations face-to-face sa family, sasabihin ng doktor minsan, pag pinauwi namin tong pasyenteng to, malaki ang chance ang babalik siya sa ospital. So talagang nire-recommend namin na mag-skilled nursing facility. Pero yung family, kadalasan sasabihin nila, pagka talagang sure na sila na hindi, sa bahay lang, kaya namin siya i-manage sa bahay. Ganon. So yun yung parang challenge sa akin na how can I advocate for the patient na, para hindi siya ma-readmit sa hospital, para mas ma-continue yung care niya. Ganon. Those are some of the challenges. And, sometimes hindi talaga siya nag-work out, madi-discharge mo yung patient, and then couple of days later, couple of weeks later, biglang makikita mo nandun na naman ulit. And the bad thing about doon is if they're back for the same reason. Pero kung iba naman, then okay, iba pa
Mhm.
rin ang problema. Ganun. Dami, no?
Oo nga eh.
I'm
Ah,
really
so,
trying to cut it
ah,
short talaga, sa totoo lang.
so gaano katagal ka na nag-case manager?
Okay, so it might not seem much, but I feel like I've been doing it forever, and I've only been doing it for 5 months. And sa 5 months na yon, ang dami ko nang natutunan, and I'm very, self-aware na mas marami pa akong kailangan matutunan. So hopefully, sa mga aspiring na RN case managers, get your foot in the door. Don't be afraid. As long as you know kung paano mag-manage and mag-treat ng patient, as long as you can understand kung paano yung course ng treatments nila, you'll be fine. And the cool thing about case management kasi is you have more time to sit down and review yung cases and to fully understand kung ano yung nangyayari sa kanila, kung ano yung kailangan pang mangyari sa kanila, tsaka kung ano yung magiging parang discharge plan nila, you know? So, even though I'm still new, meron naman na akong experience sa bedside. So, it just really takes, applying yung bedside learnings and knowledge mo to coincide with case management.
Okay, okay. Sa work na 'to, wala namang overtime eh, 'no?
Sa akin, actually, meron. Pero
Mhm.
I try to use it sparingly. Kasi if sobra sa overtime, it would show na parang hindi ka marunong mag-manage ng time mo.
Aha,
Ganun.
aha.
So, I try to limit yung overtime ko, although yung director ko naman, lagi ko naman sinasabi na, hey, direct, pwede ba ako mag-overtime na konti? And then I'll tell her why. Ganon. Tapos, she
Hmm.
usually approves it naman, and then I try not to overstay talaga. Kasi syempre, gusto natin umuwi, di ba? 4:30 ang out mo, tapos aalis ka ng 6:30.
Of course.
Naman.
Of course.
Although it's OT, pero I mean, si Uncle Sam pa rin ang makikinabang.
True, true, true. Wait, sa ganitong work na 'to, may mga chance ba o may mga panahon ba na parang you need to take home the work or talagang sa office lang talaga?
Ako ang sa akin, I'm lucky enough na I don't have to take any work home. Pero yung
Mhm.
other friend ko naman, he does have a work laptop. na
Mm.
he has to take home. So kung kailangan man ng something, he has access to it.
Ah,
Pero ako,
okay.
for me, not necessarily.
May mga times ba na parang on call ka, you need to see lang or you need to biglang, you have to communicate for the patients sa mga ibang facility, ganyan? Or talagang doon lang sa working hours mo, doon ka na nag-work?
So sa akin naman, I try to stay yung sa within working hours ko. Usually, 95% of the time, ganun naman.
Mm.
I still do get texts from yung mga other skilled nursing facilities sometimes on the weekends. Sasabihin nila, hey, we have beds, ganyan-ganyan. Um, Pagka ganun naman, pero usually alam naman nila na Saturdays and Sundays were off. So, it's very rare, far few between, o kaya yung mga bagong kakilala lang na hindi sila aware pa. Pero usually, wala naman akong nakukuhang any business outside of my hours of work. And para ma-prevent ko rin yon, kailangan I set my week up to prevent that na kumbaga parang na-endorse ko lahat prior to going over the weekend. Kasi usually, ang ka-endorse ko would be the house supervisor.
House supervisor of the facilities, no?
Yeah, no, house
Uh,
supervisor ng
sorry.
hospital namin. So, ang mangyayari is, kung meron pang anything that needs to happen over the weekend, let's say,
Ah,
this patient needs to discharge over the weekend, nakausap ko na yung doktor, Doc, sa tingin nyo ba, over the weekend to ma-discharge? Oo, actually, pwedeng sa weekend na. Okay, Doc, so ganito gagawin ko. Kukuha na ako ng room dun sa skilled nursing facility, magsa-set up na ako ng transportation. Ang kailangan na lang gawin ng nursing department is i-activate nila yung transportation, and then pwede nilang ma-discharge once you put yung discharge order in. Ano, so usually I communicate that sa charge nurse tsaka sa
uh-huh.
house supervisor, and usually naman they take over basta may proper endorsement lang ako.
Okay, okay. For you, anong most challenging part mo as a case manager?
I would say is still keeping yung human side of it. Kasi
Mm.
meron akong mga nakatrabaho ng mga case managers before na they just see yung name ng person on a piece of paper and that's it. Wala nang regard about
Mhm.
ano pa yung kailangan nila na treatment sa hospital. Pagka sinabi, kasi usually, depending sa diagnosis, merong certain number of days na allowed ang patient to stay sa hospital. Hindi siya one to sawa. Like let's say kung UTI siya, they take into various considerations yung age, yung severity ng UTI, yung just the diagnosis in general, and then doon ika-calculate based on some scale na i-determine nila kung gaano katagal yung pwede mag-stay yung patient. So like, let's say yun nga kung UTI, um, ganito yung age niya, pwede siya up until 3 days lang. So kung pag lumampas ka na ng
Mm.
3 days and then it's managed by an insurance na merong insurance case manager, kumbaga parang lagi mo siyang kailangan bigyan ng rationale kung bakit nandun pa rin yung pasyente at ba't hindi pa siya nadi-discharge. Kasi otherwise, kung wala na siyang reason to stay in the hospital, pero nandun pa rin siya, they might not reimburse yung hospital any longer pagka lumampas na sila doon kapag walang valid reason. Ganon. So just keeping that human side to it na you can kind of still advocate for the patient. Kasi, I still go in there and talk to the patients. I see the patients, I get to know them a little bit, yung background nila sa family, ganyan,
Mhm.
kung sino yung kasama nila sa bahay, things like that. So just advocating for them, pero still well within reason naman kung there is something to advocate for.
In terms of salary, is it higher or lower as compared to bedside nursing? Kasi a lot of people would also consider that eh.
Okay, so in terms of case management salary, I want to say it varies.
Mm-mm.
Okay, kasi ako ngayon, tumitingin ako, kasi you can actually do interesting fact about case management, you can actually do it remote, and so it depends then kung saang company ka mapupunta. Usually, pagka inpatient or hospital na case management, kaya niya makipagsabayan sa bedside,
Mm.
to an extent. Um, Pero pagka-remote, usually I tend to see na medyo mas mababa siya, especially in insurance. So like let's say in state of California, Southern California to be specific, case management pay ranges sa inpatient can vary from 45 to $55 kung magsisimula ka pa lang. Pero sa insurance could go from 35 to parang 48, mga ganon. So very different. It depends on how you sell yourself. It depends on your experience. It depends on the company you're going to be working with. So it varies a lot talaga. Um, in terms of growth naman, medyo fair few ang mga case managers. Um, and so medyo parang mas may leeway ka in terms of leverage, I guess. And another aspect to case management is, ako ngayon, RN case manager ako. Pero I can actually, after 2 years ata, I can actually go for a CCM, which is Certified Case Manager certification. That could also help increase, yung salary ranges mo for negotiation.
So pag mo-promote ang isang case manager, the next is
For promotions, I'm not too sure. I think it's just based on seniority at this point. Kasi case management, it's very routinary yung work. Pero at the same time, it's complex kasi each case is different. It's just being able to navigate much better with more knowledge and more wisdom dun sa certain case na yon. You could have like 3 na UTI cases, pero they're all different. Tapos, seeing how a young case manager versus an old case manager would handle it varies very differently in terms of yung speed and efficiency ng treatment plan and discharge planning for that patient.
I see. Wait, so yung nag-apply ka dyan, paano ka ginayad? Like, may preceptor ka rin bang case manager or parang, paano yan? Paano, may training din ba? Paano yan?
Yeah, so actually ako, hindi naman sa, hindi sa pagmamayabang or anything, pero I guess one of the reasons why kung bakit natanggap ako kagad is because yung background ko, I came from I guess I would say prestigious na hospital. After yung previous one ko sa episode 1, I went to another hospital na was, pretty prestigious, kaso lang due to distance and all that, hindi ako nagtagal. So anyway, itong hospital na kung nasaan ako ngayon, as I said, I'm the only RN case manager there. Kasi wala na silang case manager. The only person running yung case management was the director of case management and yung discharge planner. So super short sila. So I guess that's why I was saying, they took a chance on me kasi based on my interview, I want to say na explain ko yung case management na was within the standards nung hinahanap ng director. Kasi dun sa previous hospital ko and yung hospital ko nung episode 1 was I worked closely with case managers. Lagi akong pagka may free time ako tapos nakita ko sila doon, ano ginagawa nyo? Ano yung case management? Ganon sa insurance. Oh, okay. So paano gagawin pagka, so lagi ako nagtatanong. So I had that idea. Ang present ko lang sa interview was like, just help me put it into practice and I'll show you that I can do it. So yun, so far naman, I'm still here and I'm still practicing RN case management, and nag-enjoy ako. Less stress for me kasi hindi na ako nagkakaroon ng pre-shift anxiety, hindi ako lagi nagdi-deal sa patients. Alam naman natin kasi iba-ibang personalities ng mga patients. You'll get easy, nice to work with patients, you'll also get those difficult patients. Pero at least this time ako, nasa office lang ako. And then I step up to the nursing floor pagkakailangan lang.
Yeah, I feel, yung pre-shift, na anxiety, iba talaga no?
Yeah.
Wait, so, okay, dahil napag-usapan natin yan, ano yung mga anxieties mo sa work na yan?
Case management? Yung, of course, syempre, yung mabungangaan ka sa telepono, or sometimes in person. yung mga shortcomings na in terms of discharge planning, minsan kasi based on workload, kailangan kasi within 24 hours ma-assess ko yung patient. Pero minsan depende sa workload. Like let's say ako, mag-isa lang ako na case manager, I have 35 patients. 'Di ba? Pero hindi naman necessarily na all 35 is kailangan kong kitain. No. So 35 patients na yun, let's say 25 of them are still going treatment. So wala akong kailangan gawin right now. So yung 10 na yun, I need to do discharge planning. Ganon. Tapos minsan, I pay attention to one case longer than the others depending on necessity. Kaso lang, minsan, nangyayari, nagpo-fall short ako dun sa discharge plan dun sa isa. So when it comes na discharge time na, biglang magagalit na yung family, ba't ang tagal ng ano, ganyan-ganyan, tagal na ang naghihintay ng discharge, ganyan-ganyan. So usually I just take accountability. Sorry po, medyo nagano, ganyan, ako lang yung hard. Although, syempre, I don't want to make those excuses. You try to keep it professional. You know? And then, it's really much harder pagka nagkaroon ng request na higher level of care na sinasabi. Kasi that really puts me away from the rest of the discharge planning. And then, I just focus on trying to get this patient transferred dun sa higher level of care.
Para sa mga nanonood, can you share lang parang what situation ng mga higher level of care?
Higher level of care, like let's say, as I said, yung hospital namin is a small community hospital. So pagka nagkaroon ng pasyente na kailangan ng coronary stenting, ganon, wala kaming, anong tawag doon? Yung cardiology na lab? Cath lab. Wala kaming cath lab. So I have to transfer the patient out para magkaroon siya ng, coronary angiogram. Ganon. Sometimes plastic surgery. Kung merong isang pasyente, I had a patient before, nagkaroon siya ng compartment syndrome para ma-relieve yung pressure, yung buong forearm niya, kailangan buksan. Kaso lang, as a general surgeon, hindi niya kayang isara. So kailangan ng plastic surgeon doon. So yung mga ganong cases, I had to work with. Bariatric surgery, wala kaming bariatric surgery. So usually, another one would be hematology oncology. Have a patient na very off yung WBC count nila, either super low or super high. Sometimes, suspect ng doctors there's something underlying sa ganon na hindi natitreat ng antibiotics. So, they would suggest seeing a hematologist, oncologist. Ganon. So, usually, ang higher level of care would be services that you cannot normally provide dun sa hospital mo.
I see. Ang seryoso natin. Okay. What's your most favorite and least favorite part sa case manager?
Okay. So, I guess least favorite part ko muna. And my least favorite part is yung times na ako, alam ko yung background ng patient and ng family. Pero at the same time, napupush ako ng director ko na, hey, sorry, pero kailangan na natin ma-discharge yung patient. So yun yung business side nun. So again, patient advocate, within reason, kapag kaya ko pa namang i-extend yung stay ng patient for, very valid reasons, I'll do that. Pero pagka inano na ako ng director ko na, hey, we really need to get this patient out, we're losing money na with this patient staying here, then yung parang medyo mahirap sa akin na tatawag ako sa family, hey, sorry, this is it. Wala na siyang kailangan na stay pa dito sa hospital. Either discharge ka na namin or you would have to file, like let's say for Medicare, you have to file an appeal with Levanta, ganon. Or either that, you will start to become financially responsible na, will start billing you, ganon. So yun yung minsan medyo mahirap sa akin kasi number one, still, nurse ako, and case management in a way is ito yung business portion ng nursing eh. Kasi nga, you have to make sure that it's still cost effective dun sa hospital and the patient. Favorite part ko naman is, of course, being able to help yung mga patients and their families kahit na hindi na ako sa bedside. There is still that help that you can provide. Hindi porket hindi ka na bedside, hindi ka na tunay na nurse. No. Sometimes, in a way, mas alam mo pa kung ano yung nangyayari dun sa treatment ng pasyente as compared to the actual bedside nurse. Kasi you run the show as a case manager. So pagka nag-iintayan yung mga consults, diba, minsan sinasabi ng doktor o hintayin na lang natin yung clearance nito, tapos walang gumagalaw dun sa clearance. Let's say kung cardiologist or GI, ganon, I have that freedom na tumawag sa doctor, hey doc, ano pa ba ang kailangan natin para dito sa pasyente? Pwede pa na ba natin siyang i-clear? Ganon. Kasi we need to see if we can discharge this patient. Safe na ba siya sa'yo para ma-discharge na namin? Ganon. You run the show. You provide the resources for everybody. Kung kailangan ng cardiologist, kailangan ko ng coronary angiogram. O sige doc, ito yung insurance niya, I'll make the calls, ganyan-ganyan, we'll get them out. Ganon. Tapos kung GI naman, kailangan ng peg tube. Okay, sige, we'll get this patient a peg tube, coordinate with you. Usually naman pag ganon, they coordinate with the nursing floor na directly. Pero it's my job to ensure na nagawa talaga yung peg tube on that day na sinabi na gagawin. Kasi otherwise, that's gonna be a delay in treatment. We can be penalized for that. Yung mga ganon. I have to make sure that everybody's running based dun sa timeliness na kailangan para sa pasyente for their treatment. Kasi as I said, meron lang limited number of days na binibigay usually based on diagnosis and yung plan of care for the patient. So I have to make sure na everything is flowing along smoothly para sa patient. And, that's my favorite thing, just being able to see everything working together, being able to see na yung outcomes dun sa treatment is, positive para sa pasyente, it works out for the family, and it works out for the patient. Ganon. And you still get the thanks from the families. Kasi minsan, side topic lang, there are times din kasi na families, the patient would come from a skilled nursing facility A, pero hindi nila nagustuhan yung skilled nursing facility A, gusto nila lumipat sa iba. So, I try to look for another skilled nursing facility for them na mas okay sila. Kasi usually, sasabihin, complaints, hindi masyadong nagpipay attention dun sa family member ko, or nahulog siya doon, ayoko yung service nila, ganon. So in a way, kung kaya ko silang malipat within a reasonable time frame, I'll do it. And once I get to do it, yung thanks nila sa akin, pero I can't always, take all that credit. I have to give it to my discharge planner then, who always helps me out sa ganon. So it's always a team effort from nursing department to radiology to everybody. Always a team effort. We just make sure na number one, safety ng patient din.
Okay, no? So, grabe, you coordinate with a lot of people, no? And you really have to meet deadlines, no?
Yes. So yun yung I would say, yun yung one of the pressures ng case management. So kung medyo magaling kang magboka, kung bakit kailangan pa mo nandito yung patient, I guess dun siya papasok. Pero otherwise, just make sure that you're able to meet those deadlines, and then you're able to coordinate talaga accordingly with yung mga physicians, with the treatment team, OR, ganyan. Para wala talagang delay and hindi ka mapuput under fire. Bakit nandito pa yung pasyente na to? Diba?
I see. Okay. So, mukhang enjoy nga yan, ano? And maganda nga siyang field. Ikaw ba na-miss mo pa yung bedside nursing chat?
Honestly, no. Hindi na. And I want to say na isa sa mga perks ng case management, and I don't know if this is going to be frowned upon or not, pero sa akin, kasi we get spoiled, yung mga skilled nursing facilities, they come to our hospital, gusto makipag-meet sa case management kasi they know na sa amin nanggagaling yung referrals. So they treat us to lunch, they give us like, snacks, treats. So, yun, medyo kakaroon na ng weight gain. Kakaroon na ng weight gain because of that. Pero ako naman, for me personally, I'm a very transparent person. Kung I can help accommodate and help their business, I'll do that. Pero syempre, well, within, patient's choice pa rin talaga ako. I'm a number one patient advocate talaga. So if it's something that I can help the family and the business out, why not?
Mhm. Mhm. Okay. Actually, gusto ko nga itanong sa'yo yun kasi naalala ko na-mention mo yun.
Yeah.
Grabe, dami namin natutunan naman sa'yo, Chad, ha?
Yeah. So nakita ko dito, may timer 47 minutes na ata to. I
Yeah.
didn't feel like that at all. So it
Oo
was
nga, ang bilis eh.
yeah, it was a very nice treat to talk about case management.
Yeah, kasi, alam mo, nagulat lang din ako, no? Parang, isang tanong ko, ang haba ng sagot mo. Ang dami talagang kailangan pag-usapan tungkol to
I
eh.
know, I'm
Tungkol dito,
sorry
no?
kung medyo masyadong mahaba, pero I mean, I think case management deserves that recognition. Kasi
Aha,
usually yung
aha.
iba, ang notion kasi with case management is, ay, hindi ka na nurse. That's not real nursing. Pero
Talaga.
ako ang sa akin, well, let me tell you why it's still real nursing.
Mhm. I think we're good. Do you have more, do you have other things to share for the people watching?
Um, yeah, so if you feel na medyo, kasi ngayon it's very common na nurses are getting burnt out from the bedside. Ang dami ko naririnig from the past nurses na hindi na ganito yung nursing as before. And there's a lot of things that goes on in terms of like parang abuse against nurses. I don't want to put nursing in the bad light, pero these are the realities of nursing na you have to be, you have to be expecting. It's not always sunshines and rainbows. It's not always going to be, oh, let me help you. Oh, thank you for your help. No, it's not always going to be like that. Pero if you feel now you're getting burnt out from the bedside, that's okay. And if you feel that you need another, change in, departments ng nursing, I think case management, kung mahilig ka maipag-usap sa tao, mahilig kang maipag-usap sa families, ganyan. If you feel like you still want to help people, you can still help with case management. Kasi you know the patient from start until finish. Kasi yung iba, pagkagaling ka ng ER, yung ER, stay mo doon, yung kilala mong nurse doon, hanggang doon lang siya, di mo na siya makikita ulit. Yung pagkadating naman doon sa nursing floor, pagka start to finish mo ng nursing floor, andun na siya ulit. Pero did you know, even sa case management, sometimes you even follow up after discharge nila sa hospital, just to kind of check up on them. Or sometimes you still coordinate, dumating na ba yung home health, things like that. So you still are able to help with patients and their families. So if you feel like bedside is a little bit too much for you, maybe case management can help you out. Kasi nakakatulong ka pa rin. And it is still true nursing.
Yeah. No. And about dun sa burnout, dito sobrang burnout yung mga tao dito.
Oh my goodness. Oh my goodness. I feel your pain, guys. Talagang ako dati, I used to come in to work 6 a.m. to 2 p.m. Pero actually, nakaka-uwi na ako 6 p.m. kasi nag-OTY ako ng hanggang 4 p.m.
Okay,
Dahil
man. Yeah.
sulat kamay lang na documentations, di ba, Kuya Dean?
Totoo
So,
yun, totoo
ang
yun.
office ko nga dito, kahit papano, it's computerized. Pero still, nursing burnout is real. There's no shame in it. If you feel like you need to take a step back and, catch a breath, for your mental health then, I feel like hindi rin masyado napapag-usapan as much on mental health. But if you want to live a long and happy life, and then you retire happy, I think you need to kind of take a step back, take a breather, ganon, di ba? Buhay, sabi nga ni Kuya Kim, weather lang, di ba?
Okay. Wow, Chat, thank you so much for spending time with us and sharing your knowledge about case management.
Yeah, anytime. Thank you again so much for having me. Sobrang tuwing nandito ako, I enjoy it. Super fun, easy talks, di ba? And I hope nakatulong ako sa mga aspiring, case managers out there. Kung undecided pa kayo kung anong career path nyo sa nursing, maybe this could be it for you. Try it, and, ang daming branches ng nursing. You can't miss. Kinaganda ng nursing, you're always needed. Kahit saan ka man dupalot ng mundo, you're always needed.
True, true. Okay. Okay, chat. Thank you so much. I'll see you dyan soon.
Yes, yes. Thank you, Kuya Din, and thank you for everybody that tuned in. And yeah, continue to support his channel. Very, very informative, very educative. Thank you, guys. Thank
Okay.
you, Kuya Din.